federal government is intensifying urgent efforts to prevent the deadly Mpox Clade 1b from entering Nigeria as the disease rapidly spreads across regions. It said starting in the south and southeast, cases have moved toward north-central, northwest, and northeast Nigeria, raising serious concerns. Dr. Jide Idris, Director General of the Nigerian Center for Disease Control (NCDC), revealed that increased surveillance along border states is critical to stop the outbreak, stressing that neighboring Cameroon, where all Mpox strains have been reported, poses a significant threat as the government's primary focus is on Clade 1b, the most dangerous strain known for its severe symptoms and higher mortality rates. Addressing the media, Dr. Idris noted that the spread of Mpox is not a new phenomenon. Hence, historical reports indicate early cases likely went undetected in areas like Arab states, only to be discovered later in Port Harcourt, setting off the current wave of infections across Nigeria. He also highlighted the severe impact on states like Ogun and Lagos, calling for a unified national response.
On the other side of the borders, we've linked up some of these officers, port health officers, with the states around those areas again so that they can work together just in case they see any cases again. Because there is usually cross-border transmission between the Cameroon and into Nigeria. Those are the things that we have to check. That's why it's very specific. Now, part of that again, apart from surveillance, is detection of these cases. So detection again, depending on the organisms, we have specific modes of detection. For Mpox, it is essential for us again to increase the capabilities of detecting centers. We have laboratories all over the country, but each of them again, they don't have the same capabilities to do. We have many cases that do PCR detection. What we are trying to do now is increase the number of laboratories all over the country to build their capabilities to be able to detect for Mpox.
Speaking beyond Mpox, Dr. Idris expressed deep concern over rising cases of Lassa fever, cholera, typhoid, malaria, and even meningitis, stressing that despite some seasonal declines, these diseases continue to spread. He stressed the urgent need for state-level emergency preparedness and reviewed the NCDC's efforts to strengthen laboratory capabilities across the country to abate future outbreaks.
Yeah, there's a declining trend in the number of suspected cases of fatalities. And of course, again, fewer states now are reporting cases of cholera. But we should not rest on our oars because one, we still have the rainy seasons, and two, remember the flood recently now. And flooding also have the health consequences. This year alone, Lassa fever cases, meningitis cases were more in number and death rates this year than we saw the previous years. We do not want that to happen again in the next season. So there is a need to start taking precautionary approach, preventive approaches now before they get at us.
Meanwhile, Dr. Tochi Okwo, antimicrobial resistance lead at NCDC, warned against the overuse of antibiotics both in healthcare and agriculture. She stressed that the misuse of antibiotics is fueling the rise of drug-resistant infections, making them harder to treat. Dr. Okwo noted that AMR is a silent killer as drug-resistant infections are often underreported, with many deaths linked to improper antibiotic use. She urged both individuals and communities to take responsibility, advocating for improved hygiene practice and better management of antibiotics.
Other things that are driving these antibiotics is the poor hygiene level at community level. We have open defecation, there's poor water, sanitation, and hygiene infrastructure in communities. And also we have poor sanitation in some of our health facilities, our farms, our abattoirs, our meat markets. Some of those places where our food is sold are all these different ways that continues to increase the burden of infection and therefore driving this antimicrobial resistance.
The NCDC is calling for a multifaceted approach combining preventive measures, responsible antibiotic use, and heightened public awareness to contain the spread of disease and reduce future outbreaks. Vincent Okushi, reporting for Quality Television.